Hi everyone. This presentation will be about signs and symptoms for the different disease. Because in NCLEX RN, we have to cover so many disease, and some of signs and symptoms, they are quite similar. And if you don't know signs and symptoms of each disease, then you can't really answer the question because you don't know what condition they are, then how the treatment gonna be. So it took me a while, but I have come up with a summary that distinguish them and simplify in a way that we're able to understand. So let's get started. All right, welcome. You can download the template that I have attached on the descriptions. This presentation is for the purpose of private study and research. I mainly use Kaplan, UWorld, Registered Nurse RN, NCSB, and few others websites. Okay, signs and symptoms. On the left side here are the signs and symptoms. Okay, on the right is the conditions. So you can see how one signs or symptoms could mean so many conditions. So you can categorize like that. That way, it sort of gives you some idea what it might be. This is one way that you can summarize it. Another way I did it with it's through airway, breathing, circulation, and other. So signs and symptoms airway here. Scenarios I like to put it here because in what situation does it cause airway edema? Fire, drowning, like in NCLEX world, sometimes they will give you a sort of what happened, like how did it happen? For example, choking, someone's eating something, peanuts, nuts, some fruits, things like that. So that should give you a sort of flag that where the question's heading to. So the airway, here are the conditions, the airway issues. And equal means the management, like here's the signs and symptoms of partial airway obstruction, then what's the management for it? I like it to put it together because in the exam, first they take, for example, they give you signs and symptoms, then they want to know how you're going to do it. So it's good that they put them together. Again, signs and symptoms, breathing, scenario, respiratory depression. The scenario could be the overdose of certain opioids like morphine, heroin, and fentanyl. And then they will give you signs and symptoms, and then what would you do? I put complications here because you need to know complications in order to answer the who do you see first. It helps you with who do you see first. You see the complication, which complication is more severe, then that usually is the one. Of course, airway, breathing, circulation usually is the first line. Then circulations. For example, for increased ICP, scenarios, patient with shock, MVR, high blood pressure, MVA, motor vehicle accident, okay, which increase ICP. And then the complications. So signs and symptoms, sometimes they like to say what's the earlier and what's the late sign of it. And so there's another way I also do. If some of my study notes doesn't fit into ABC, I do it like this. This is another way that I do it. I'm trying to. Okay, so the conditions. Based on the conditions, if I feel that they don't, I don't know, should I fall into ABC, then I go like this. Conditions, expected signs and symptoms, mild, less urgent, in comparison to unexpected, severe, urgent. So what that means is sometimes this works well with select who do you see first as well. And on top of that, it gives you priority. Like let's say patient present with depressions, and then here are his following signs and symptoms. What would you like do first? So he got sleep depriving, no participating social media, and has suicidal ideations. With this one, it's not unexpected. It's expected, but it's severe. So I put it on the right side here. That way, then when the question comes, of course, we're going to pick suicidal ideation because it's in here. And again, for example, Parkinson's, if they have slow movement, loss of balance, we know it's sort of unexpected. It's expected. It's less urgent in comparing to drooling, which is to do with the airway, because there's a risk of aspiration. That's how I remember like that. Because some question they say, here's the following 3 conditions and signs and symptoms of them. That's okay. That means it's expected. And then there's a situation of here, unexpected. Then I'm going to pick the one condition that's unexpected in comparison to the expected one. So that's how this graph helped me to encounter the who do you see first, the priority questions. Again, similar, but this applies to post-operative, because in post-operative, the question like to say patient has certain surgery and then come back and then present following signs and symptoms. What should we do? So I category again to expected, unexpected, A, B, C, airway breathing issues, and others. So, for example, I'm going to take breathing, for example, diminished breath sounds. What we can do is coughing, encourage cough, deep breathing, use of incentive spirometer. Where in comparison to unexpected urgent sign, labor breathing, that's a warning sign. So if patient come back with the diminished breath sounds, we can do following things. And it's less urgent in comparing to the labor breathing, right here, right now problem. Example of post-operative surgery procedures, for example, thyroidectomy. Patient complain of pain at the surgical site. We can give analgesic and semi-phallus positions. Well, unexpected severe signs make noise when breathing. That's to do with something's wrong with the airway there. So, in the question, if someone has thyroidectomy and then they complain of pain, usually in comparing to anyone who got unexpected sign, usually it's more. The unexpected signs usually take priority. So, but then you need to know which one's expected, which one's unexpected. Quite similar, except this time is diagnosis. For example, colonoscopy. Expected is abdominal cramping. So if patient complain of abdominal cramping, that's expected. Unexpected is hypervolemia symptoms such as decreased blood pressure, increased blood pressure. Decrease. Oh, it should be. Oh yeah. Decreased blood pressure, increased heart rate. So, sort of in a shock mode. Okay. I also graphed it like this. Not the answer for signs and symptoms of the disease. For example, I'm gonna take, osteoarthritis does not cause fever. Rheumatoid arthritis cause fever, but not osteoarthritis. So I just make a table like this saying this is the wrong answer. Epiglottis does not produce cough. It has chest retraction and drooling. So that way, next time when you see it, these questions tend to you tend to get tripped into a select order apply questions. Here's the condition, here's the sign and symptoms, and which one doesn't relate to the conditions. And that's all. Thank you.